Hello there, sorry. Yeah, I left the door open and I didn't quite hear you coming. Let me just shut this door over. How are you? I'm Dr. Sean. I promise you I'm Dr. Sean. I lost my name badge, but you have to believe me, I'm Dr. Sean. And you are? Right, okay, yeah, so we're doing the cranial nerve exam. Okay. So, you're looking a little bit nervous. Are you a little bit nervous? Well, you shouldn't be, because I'm a very highly professional and highly trained doctor. Okay, so no reason to be panicking or anything like that. Admittedly, I could have made a better first impression, but there you go. Right, I'll pop your gloves on. We're going to start with, we've got a variety of stuff to get through, okay, so I'm just going to quickly ask you, have you noticed any changes in smell at all recently? Okay. Okay. That's fine. Okay, I'm just going to have a quick look at your pupils, so just looking forward. That's wonderful. How are you feeling? Right, so a quick eye chart test here. Okay, if you can close your left eye for me. Okay, fantastic, and read off the letters I point to, alright? So keeping the left closed, that's wonderful, here we go. There we go, it wasn't too difficult, was it? No, you did really well. Okay. Now if you can close your rights over, so we can test them individually. Okay, so with the right closed for me, please. There we are, and here we go. Good. Okay, and relax, well done. So what we're going to be doing is just making a few notes at each step of the way, okay, just to say how amazing you're doing. Don't worry, I won't be writing down anything that's sort of like, patient, cannot do this, they're terrible at this test. It's not like that, okay. If there is anything that we may be concerned about, we can always book you in to see a specialist, but that's quite a rare thing. You're going to be fine, alright? Trust me, you're going to be fine. Okay. So, I am now going to be checking your eyes, okay? You can do this using an ophthalmoscope. I nearly said otoscope then. I nearly did. And it's a bright light basically that's going to be shown into your eyes. There won't be any pain or anything like that. It's a completely pain-free process. Believe me. Okay, you're going to be fine, alright? But we will need to turn off one of the lights in here just to dim the overall lighting. Okay, alright. So again, no pain whatsoever. The only sort of thing is it's quite a bright light, so, but I will warn you when I'm shining into each of your wonderful eyes, okay? Alright, I'm going to pop the lights off then if you're ready. Are you ready? Okay, you're doing really well. Alright, so we're going to pop this light off. There we go. So let's see. Okay, so we're going to be showing a bright light first of all into your left eye. Okay, in 3, 2, 1 now. That's wonderful, we're done. Okay, yeah, blink a few times. Yeah, it's quite bright, isn't it? That's why I do warn my patients. Yeah. Okay, and into the right eye. We're going to be showing the bright lights in 3, 2, 1 now. There we go. Okay, fantastic. Yeah, I kind of will shine a light at your nose there for a bit. I kind of lost sight of the eyes there. Again, not the most professional start, but it will possibly get better. Alright. Okay, fantastic. I'm going to pop the light back on, make a few notes, and we're going to move on to the very next thing. Alright. Okay, there we go. Apart from a few nerves, I hope you're doing well. It's perfectly normal to be nervous, okay? It is a big deal, I understand. So you're doing really well, so don't worry about that, okay? Alright. I'm here, I care. Okay, I care. worry about you, so don't be nervous. Okay, so I'm going to do a direct consensual pupil response test. Okay, so again I'm going to be shining a bright light into the eyes. Well, I say a bright light, we're going to be using a little handy light sheath. Okay, so I'll block out some of the intensity of the light. Is it okay if I put my hand on your nose? It's all part of the test. Yeah. Okay, fantastic. Alright, so yeah, just looking anywhere you want to, it's fine. So we're going to be shining the light into one eye, looking at that eye, shining the light into the same eye, looking at the other eye. And we're going to be doing this 4 times on each eye. Okay, so everything looks good. The pupils are responding in a normal manner. Okay, so the left and right are mimicking one another. It's great, you're doing really well, okay? Just keep being you, keep being amazing, and everything will be absolutely wonderful. I promise you that, okay? There we go, fantastic, well done. Okay, yep, so no issues. Again, we're going to make a few notes. And we're going to move on to the very, very next step. Okay, alright. Okay, more lights, I'm afraid. Yep, we do like looking at your eyes. They're that good. Okay. Again, just looking anywhere. Okay, let me bring this quite close to your eyes, swinging it from eye to eye in a U-shape pattern. Alright. Yeah, just look anywhere is fine. As long as you can keep your eyes open, which can be difficult listening to my very sleepy voice, I know. It can be very difficult. Sometimes I put myself to sleep, which is not good when you got to test somebody. And you sort of, you're checking their ears in the otoscope and then you're sort of nodding off. Yeah. Okay. Again, just looking at the way the pupils respond to the light. Okay, now looking at the other eye, which is quite difficult. So it's like I'm testing my own eyes here. Okay. You did well. Guess what? I did well too. Good. Some more notes. Scribbly notes. Okay, so right, so I'm going to just be testing your focus, okay? Convergence and blah blah blah, technical terms. Let's not worry about that. Okay, if you could look at this multi-coloured love heart for me. That's full of love. Okay, wonderful. Keep looking at the love heart. Okay, now if you could just pick a spot behind me on the back wall, anywhere will do, just keep looking at that, ignoring the love heart. Okay, look back at the love heart for me, and that's wonderful. Keep looking at the heart as I move it across, keep looking at it. Okay, get a bit closer here, keep looking at the heart if you can, that's good. And again, if you could pick a point on the back wall for me, and look at that one point on the back wall, fantastic. And look back at the heart and relax. There we go, fantastic. Good. Yep, all is well. Okay, every test we've done so far you've done amazingly well, so really well done. Okay, I don't expect to find any problems either. Okay, because if people normally sort of pass the first half or quarter of this test, then the chances are they're gonna do a whole lot very well, so okay, now this is a bit of an old one. If you could close over your left eye for me. Okay, I'm going to close my right. I'm going to bring in the fingers like so. I want you to tell me when you see them. Okay, now so looking at my nose with your right eye, keeping the left closed. Okay, tell me when you see my fingers. Good, and again. And again. And one last time. Okay, really well done. Give yourself a second. Now I want you to close over your right side. I'll close my left, and again I want you to tell me when you see my fingers. So looking at my nose with your left eye and your right eye closed. Okay, very technical, I know. Here we go. Okay, good. Well done. Good. Good. Okay, you can relax, and I can relax because that's quite difficult for me as well. Yeah, my right eye tends to water up a bit. Strange eyes. Okay, good. No issues in there whatsoever. Okay, and you found your peripheral vision was good for the wiggling finger. Okay. Good. Okay, fun endoscopy time. Okay, so now I'm going to be shining another bright light into your eyes. I know. Okay, so I'm going to be shining a bright light into your left eye. Okay, 3, 2, 1 now. Okay, that's good. And into your right in 3, 2, 1 now. Good. Okay, we're going to be checking a different thing here with the orange pupil reflection in the pupil. Okay, so just going to pop this light off again. So we're looking for a sort of reddish orange reflection. Okay, change our setting. There we go. Okay, so once again, shine a bright light into your left eye. 3, 2, 1 now. Okay, well done. That's excellent. Well done. And into the right eye. 3, 2, 1 now. And we're done. Really well done. Okay, no more lights shine to the eyes. I promise you that. Okay. So well done. Put this light back on. There we are. Fantastic. Okay, fantastic stuff. Again, no issues. Okay, any double vision at all experienced either now or in the last few weeks? Not including alcohol use. Okay. Alright. So we're going to do a follow the finger test, okay? So if you could follow the very tips of my fingers, keeping your head as still as you can, just moving your eyes, follow the tips of my fingers, there we are. Okay, I'm going to vary the speed because we're going to make it a little bit more difficult for you and a bit more entertaining for me. Okay. Good, and on the other side, follow the tips of my fingers, keeping the head still, just moving the eyes. Okay, well done. Okay, just look at the behaviour of both your eyes as you perform this. There don't seem to be any difficulty. Good. Blink a few times, yeah. Okay. Any double vision during that test? Okay. Good. Okay, so we're doing some touch sensations. Okay, so any pinprick, any fine touch. So this is the pinprick with a relatively sharp object. These are very blunt scissors, okay? The most blunt ones I could find. They won't be hurting you, okay? This is how it feels. Okay, how was that? It's okay. There we go. Right, so I'm going to be just brushing this 3 points on each side of the face. And I want you to tell me when you feel it, okay? There we go. On the other side. Tell me when. Okay. So, that's good. Did it feel more or less the same each side? Okay. Good stuff. So now the same again. I'll get one of these out. So this is a Q-tip or cotton bud. So we use this as a soft object. Okay, so this is what it feels like first of all. Okay, now I need you to tell me, just as before, what we've done with the sharp scissors. You tell me when you feel the object brushed across the face. Okay, same points as before. All right, so tell me when. So you felt each one successfully, which is good. And did it feel more or less the same on each side, soft each time? Alright, that's what we like to hear. Okay, fantastic, good. Okay, just really holding your temple region, is that okay? Just on the side of the head there. Okay, thank you. Okay, any pain at all? So that feels okay. Alright, if you can open your jaw for me. And close. Okay, go feel underneath the chin. Any pain at all? How about here? That's okay. Okay, if you can open your jaw for me. Okay. Close. Okay, feeling down the neck, is that okay? Thank you. Okay, any pain at all? Okay, if you could swallow in your own time. And any pain when you swallowed. Alright. Okay, if you could raise your eyebrows and keep them there. Okay, excellent, relax. Okay, puff out your cheeks. Don't let me press them in, don't let me press them in. There we go, well done, relax. And a big teethy grin so I can see your front teeth. And hold it there. Okay, you have very unique teeth. That's good. Okay, if you can purse your lips, like that, just like that. Keep it there. Beautiful. Have you noticed that your hearing sounds louder than usual? Okay. Now I want you to close your eyes. Now I'm going to try to open them. I want you to keep them closed as best you can. So close your eyes for me. There we go. Keep them closed, keep them closed, keep them closed. There we go. Fantastic. No issues whatsoever. Okay, you're doing incredibly well. Okay, we're whispering some numbers and letters in your ears. Okay, I want you to repeat them back to me. Okay, so I'm going to look at you, and that's when I want you to repeat them. Okay, I'm going to cover everyone here. 28. 45. Okay, let me do that one again because there was a car passing. So 88. Okay, fantastic. Yeah. Okay, we'll do some 2 letters this time. All right, but I'm going to be just rustling my fingers in the other ear just to make it a bit more difficult. Okay. All right, here we go. K. S. Okay. V. R. Okay, wonderful. Good. Okay, fantastic. So no issues there. Okay. Alright, tune in full time. Which is here. Okay, so I'm going to place this on the forehead to begin. Okay, I want you to tell me, does it sound more or less the same on both sides? Okay, here we go. Take a good listen. Okay, one more time. Okay, did it sound more or less even? Okay, I'm going to whack this on the left side. I want you to tell me if it sounds louder on your left side. Here we go. Okay, is it louder on the left? And now is it louder on the right? Okay, you can open your mouth as wide as you possibly can and say ah. Okay, and if you can just raise your tongue into the roof of your mouth for me. Okay, if you can put your tongue into your left cheek, keeping the mouth open as wide as you can, and into the right cheek. Okay, that's wonderful. Relax. Good. Okay, I've got a few minutes now just to catch up on the right. You're doing amazing. Not long to go now. Okay, we're nearly there. Okay. Hope you're feeling a bit less nervous. Yeah, it's not too bad, is it? Because the fear is always worse than the actual event. Yeah, our brains can overthink and stop us from doing things that even give us joy. It's a real shame, but yeah, that's sometimes the way our brains work. put your tongue into your cheek and press against my hand. Okay, so into your right cheek first of all. Press, press, press. Good, and to the left. Press, press, press. Okay, fantastic. I'm going to place my hands on your shoulders, is that okay? Alright, if you could shrug your shoulders for me nice and high and keep them there. Okay, I'm going to be pressing down, wait to keep them up as best you can. Here we go. Press, 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 press. And well done, relax. That's awesome. Okay, that's it. I think I've run out of tests now, so we'll have to leave it there. It's been an absolute pleasure. Okay, so you've done incredibly well. Nothing to worry about at all during any of those tests. You've done amazingly well. Okay, so you should be very proud of yourself. Okay. All right. You clearly take good care of yourself, which is great. And now all I need to ask from you is to continue to take good care of yourself. All right. You must promise me that. So we'll see you again probably about 6 months or so. And yeah, we'll repeat the same tests and no doubt you'll do just as well. Okay, pop this in the bin. There you go, I'm an expert at that by now. Okay, yeah, so just book in at reception. I'll process you through to book another appointment in 6 months' time. It's an absolute pleasure. Alright, take good care. I'll see you soon.